Good afternoon, everyone. Good afternoon, welcome. I'm Stephen Grimaldi, the Executive Director of the New York Common Pantry. Today, we'll be providing an overview of the issue of hunger or food insecurity on a national, city, and state level for our second State of Hunger presentation, August edition. We're going to talk about and review the level of need here in New York City. I'm going to put a face on those hardest hit by food insecurity and income inadequacy. We're going to introduce that term and talk to you a little bit about it. And we're going to talk about the true cost of living report, where that definition and that term comes from. We'll also address how the New York Common Pantry works directly with people in need and how we serve communities where residents don't meet government requirements for support services. Just in the way of explanation, so you're aware, please feel free to put questions in the chat. We will be trying to get to those questions at the end today. We'll try to be efficient. If we don't get to everyone's questions, we will get back to you in the coming days with answers to those questions. As again, we'll try to answer as many questions as possible. I mentioned I'm Stephen Grimaldi, the Executive Director. Today I'll be joined also by my colleague Diana Duarte, who you can see on the screen. We'll hear from Diana in a little while. On the screen, you see our mission statement for those of you who may be unfamiliar with the New York Common Pantry: to reduce hunger throughout New York City while promoting dignity, health, and self-sufficiency. And you'll see through the different types of services that we provide how we go about doing all of those things. Just a couple of definitions as we start. We get asked this a lot, and I'm going to throw 4 important terms at you today. We'll start with something I think is a little bit easy, or somewhat complicated for often because people come and say they don't understand the difference. So why do we have hunger in our mission statement? But food insecurity and hunger are different things. You can be, in fact, both. Food insecurity, as you can see, is defined as a lack of consistent access to enough food for every person in a household to live an active, healthy life. You do not necessarily need to be hungry to be food insecure. Hunger, of course, is the feeling that someone has when they don't have food. Hunger may result from food insecurity. According to the USDA, more than 34 million people in our country, including 9 million children, are considered food insecure. It's a big number. And the crisis of food insecurity is not just an urban one. Every community, the suburbs and rural communities have food insecurity, and many communities also have individuals who are hungry. In New York State, 1 in 10 households are considered food insecure. Now, luckily, we've got powerful tools to fight food insecurity. One such tool is the Supplemental Nutrition Assistance Program. This is important for what it does and who it serves as much as who it doesn't serve. We'll talk about that in a second. The Supplemental Nutrition Assistance Program, or SNAP, was formerly called food stamps. Many people are familiar with that program's name. It's absolutely essential. It helped lift more than 41 million Americans out of poverty last year just due to inadequate income and the wage structure. And due to record inflation and wages that have just not kept up, nearly 1.7 million New York City residents rely on SNAP. I'll say that again, nearly 1.7 million New York City residents rely on SNAP. Unfortunately, in March of this year, March 1st, Congress cut the temporary boost to SNAP benefits. That was implemented, the emergency allotment was implemented during the pandemic, but because of the cuts on March 1st, the average SNAP participant lost about $82 a month in benefit. And older adults felt the steepest impact from these cuts. They had their monthly SNAP benefits fall from $281 a month to $23 a month. Of course, that's less than $1 a day for food after the cut. It's important to note that being lifted out of poverty, though, and this is really important for today, does not mean you are no longer food insecure. While SNAP is a huge difference maker for people, for households, those households that experience food insecurity don't all qualify for federal nutrition programs. And these families, they utilize pantries and soup kitchens and other emergency food providers for assistance. Sometimes we're the first stop, and oftentimes we're the last stop. So people who have no other choices and no other places to go come to emergency food providers. Many ways we're a really strong barometer for what need is out there. We're going to talk about some of that need shortly. Now, in order to understand why food pantries and soup kitchens exist, we have to examine eligibility for these programs, as I mentioned. The official poverty measure is something that is used to determine eligibility for federal assistance programs. And it's actually been used since 1965. And in that way, the measure is very antiquated, outdated, and really is a poor measure. It's actually used it's based on one cost, and you'll see it on the screen. It's food, and how they do that, then they take that cost of food for the number of people in the household, and they multiply it by 3. So they only use food to calculate the cost of the household to determine eligibility for the SNAP program. Now, there's a new measure that the True Cost of Living report is a report produced by the Center for Women's Welfare and the University of Washington School of Social Work for both the United Way and the Fund for the City of New York. This study wasn't always called the True Cost of Living, it was called a self-sufficiency study, but they've been doing that for 20 years. And at the New York Common Pantry, we've been using that measure for about 15 years. What the True Cost of Living does, it measures income adequacy, and is based on the cost of basic needs for working families. So we're talking about housing, childcare, we're talking about transportation, healthcare, clothing, and taxes. It's basic needs. It's not going to a movie, certainly not going on vacation or putting money away for your child's education. It's basic necessities. So there's this notion of the true cost of living and this related measure called income adequacy. So income inadequacy is a really major issue. And by looking at the true cost of living, we can determine what that is. So while the official poverty measure identifies about 416,000 households as poor, more than 3 times as many households, 1.3, actually lack enough income to meet their basic needs in New York City. That is equivalent to about 3 million people that are considered income inadequate. So the recent True Cost of Living report highlights this number. It highlights these challenges that people have. And we see this every day at the pantry. And we've been seeing it for over 2 decades. 50% of working age households in New York City lack sufficient income to meet basic needs. What's striking about that number is it was 36% of working age households lacked sufficient income to meet basic needs just 2 years ago in 2021. So we can compare the 1.5 million New York City residents considered food insecure to the nearly 3 million that have inadequate income to cover basic necessities. And according to the True Cost of Living, an adult with a preschooler in New York City needs to make between $82,000 and $119,000, depending on where they live. Another really important thing to think about when you're talking about making ends meet is this slide here. A single parent with 1 preschooler, 1 school-age child, would need to make at least $103,000 in the Bronx and an hourly wage of over $48 an hour. That's more than 3 times what the minimum wage is. Single mothers have the highest rates of income inadequacy, with 86% unable to cover the basic needs when young children are present. The highest rates of households struggling with income inadequacy are found in the Bronx, a community that New York Common Pantry serves the borough in its entirety, but in particular the Central Bronx, where there's high levels of income inadequacy, and parts of Brooklyn, of course, Queens, and of course Upper Manhattan as well. People of color are disproportionately more likely to struggle with economic insecurity. In New York City, 65% of Latinos and Hispanics, 58% of Blacks, 51% of Asians, 32% of white households also are considered income inadequacy, but a very large percentage, disproportionate of people of color struggle with economic insecurity, unable to afford basic necessities, is highlighted here by the true cost of living. It's also really important to note that the true cost of living report is it's based on New York City. So it looks at specific costs in the city and compares them to others. Other cities do not have this measure. So it's really important and a really important way for us to determine eligibility. So we've already made the case now that so many more New York City residents struggle to make ends meet. They don't have adequate income. And we do our best to make sure that everyone who comes through our doors gets the services they need. And there are a variety of different services. We'll start with the meals. We served close to 10.2 million meals last year, or 667,000 pantry visits. It's important to note that food is central to what we do. Healthy, wholesome food, making sure that people get the nutrition that they need, that they're covering some of the most expensive food items, which tend to be the healthier ones, the non-processed ones. But we offer services across our portfolio. We have a great pantry program for seniors. We actually call it Nourish. It's commodities program. We served 4.7 million meals alone in that program last year. We have a great a soup kitchen, of course, for the homeless and all the services that go along with it, hygiene services, showers, haircuts, and laundry. And then, of course, our pantry programs, both our mobile pantry programs and our brick and mortar locations. So through a variety of programs and case management programs, we can help people get what they need. Our case management program last year brought in $7 million, over $7 million for the people that we serve in public benefits. And that number continues to go up. And finally, because we're so focused on health, our Live Healthy program provides workshops covering the basics of nutrition, helping participants to make lifestyle and dietary choices, promoting and preserving their health. Because income inadequacy combined with food insecurity can lead to the purchase of less expensive processed foods, as I said earlier. And Live Healthy provides tips on how to make the food dollars stretch, last longer. You do on-site cooking demonstrations. You also have a virtual recipe club you can access through Facebook Live and YouTube. In addition, the Farm Share program provides direct access to locally sourced vegetables, fruits, herbs, and eggs, etc. So it's important that we address the whole person and the needs that they have, bringing in resources, helping them eat healthier, purchase better, supplement their household food purchasing by adding power to that by providing pantry, and in the case of seniors, nourish packages, and of course for the homeless, a variety of services, including hot meals and brown bags. So we've taken the time to explain how New Yorkers are struggling to make ends meet, and broadly how the New York Common Pantry starts by finding out how we can assist with providing food for our guests. But many people who come here are uncomfortable asking for help, and they're considered to be the working poor. We talked about income inadequacy. So I think it's a good time to reintroduce Diana Duarte. She's one of our Help 365 bilingual case managers. Welcome, Diana.
Thank you so much, Stephen, for having me. Good to be here.
Great. Welcome. So Diana is one of the faces, one of the people on the ground. She understands the issues and everyday experiences that. So we're going to talk to Diana today about stability for our guests, how we access services, what we do, and how we do it. And we're going to talk about some of the demographics, some of the changes and recent shifts that we've seen in the people that we've served, and how we're getting to serve over 10 million meals a year. So Diana, can you start by telling us about our guests who come and what some of the experiences that they've had?
Of course. So New York Common Pantry serves people from all walks of life, not just Manhattan and the Bronx. Contrary to popular belief, we serve people from all 5 boroughs. Lately, we have seen an increase in migrants coming into our pantry. When people come into our office, once they're here, most of the times they have exhausted other options. And in a sense, we're like their last hope. Once they come to us, they're exhausted, they're agitated, they're defensive. So it takes a while to build trust with our participants. They've been to other places and they have been turned down before. And once they're here, they believe that there's nothing we can do for them, but that's part of our goal. We sit down with each participant, we empathize with them, we listen to them, and we try to build up their trust and their confidence so they're able to really discuss with us what's going on in their households. So we could properly screen them and give them the proper referrals that they need.
Diana, you mentioned that, that it's difficult to break down trust, distrust. So tell me, is there an example of someone who you worked with recently, and maybe you can tell our audience today a little bit about some of the challenges with a case that you may have experienced?
Yes. One example is I was working with a certain participant who came to our building. She was very, very shy at first. She fell on hard times. After discussing a little bit about what's going on in her household, she expressed to me that she needed some basic hygiene products, things that we don't even think about on our day-to-day use, like toothbrushes, toothpaste, toilet paper. And that's one of the things that we're able to help our participants with here. Even basic necessities can be very hard for them to access and buy. So after listening to her, we helped her with a hygiene kit. I'm also working with a family. I am working with a young lady, a mom of 4. She not recently, but she lost her husband during COVID. And that really impacted her. We see a lot of families come into our location, and a lot of these families, they're 2-parent households, and they still cannot make ends meet. They're still struggling with food insecurity. This particular woman that I'm working with, she had her husband he passed away during COVID. It was very hard for her to keep up with her rent. It was hard for her to keep up with basic food for her children once the SNAP cuts were taking into effect. She was coming before for pantry services, but she stopped for about a year or two. Once the SNAP cuts took into effect, she came back to our location asking for help, and we signed her up for pantry again. We also spoke to her about our hot meals program for her and her kids. She comes with her kids Monday through Friday to eat a home cooked meal, takes the stress off of her. She also comes during the weekend. We give out what we call brown bags. She comes to get that for her and her kids. This particular young woman, she is working 2 jobs currently. And unfortunately, it's still not enough. So with the pantry services that we're able to provide for her, and with also the hot meals, the brown bags, we are trying to, at least make it a little bit more bearable for her, since she has been through a traumatic experience. We're also helping her with rental assistance, since unfortunately, due to funeral expenses, she fell behind on her rent payments. So we're assisting her with that also to take some weight off of her shoulders.
You raise such an interesting point. My heart goes out to that woman and her family. And this is something that you see a lot of. I know a number of years ago, the Robin Hood Foundation did a report and talked about the challenges every time there's a life situation for people that are living in poverty or struggling to make ends meet. In this case, losing a husband, losing, one of the breadwinners in the house, has a major impact, right? But now you can't pay rent, and the challenges of having to cover all those bills while you're going through this trauma and you're grieving. So the challenges are there. So it's good to know that we can at least provide those economic necessities, listen, empathize, and try to get those services in place for people who are going through that. Diana, one of the things that I think is really important and something that we've worked very hard to do is be, as proficient as we can in multiple languages. And I know we've got examples, especially now. We're going to talk about migrants in a few minutes because that's a big issue right now and some of the services we're providing. Can you talk a little bit about what happens when an individual comes whose English may not be their first language?
So the good thing about the Health 365 office is that we do have bilingual case managers. We have some that are fluent in English and Spanish. And we also have bilingual case managers that are fluent in Mandarin and English, and as well as Cantonese. We also have someone here that is fluent in French as well. And if there is a language barriers, which we do come across people that we just can't communicate with, we use Google Translate if push comes to shove. So we try to figure out any way possible for us to work with someone to see how we can help them.
And I know recently we've had the challenge of having many French speakers, right, coming, and we luckily have a native French speaker on staff who can help. A lot of folks coming from Africa who come from the former French colonies and ultimately who speak French as their first language or one of two languages they speak. So it's just really important to be able to understand and communicate, and then to be able to refer appropriately. So I think it's a really important part of what we do. You mentioned some of the stories and the single mom. That one really stood out for me. Can you talk a little bit about the elderly seniors who come to our programs? We have a lot of programs that help them. And I just want to also let the folks on the webinar today know that 1 in 5 seniors in our city are considered food insecure. People who live on fixed incomes have some of the most challenging economic situations, and they come to us in need of a whole host of services. And it says a lot when a senior comes out of their home, gets on public transportation, brings their cart, fills it up, and then goes back home, right? It just says how much. So what we do is we have a mobile program. We'll talk a little bit about that. But Diana, maybe you can just start by telling us a little bit about seniors and what we do for them.
Yes, of course. So besides families, we see a lot of seniors come into our location. The elderly that come over here, they're, like my colleague said, on fixed incomes. And they may be on fixed incomes, but most of the times that fixed income is a bit too high for them to qualify for SNAP benefits, unfortunately. And with that being said, since Nourish, it is a federally funded program, they also have a specific income threshold. And some of our seniors, unfortunately, don't qualify for the Nourish program due to their fixed income being a bit too high. So we offer them pantry services if they do not qualify for a Nourish program. Speaking of the seniors, if you don't mind, Stephen, I would like to share a story with one of the participants that I'm working with. Okay. I'm currently working with a senior lady dear to my heart. She is from the community. And when she came over here, I was a bit upset of the things that she told me she's going through. Like I said, it takes a couple of visits for our participants to finally open up to us and feel comfortable. Once she finally felt comfortable enough to open up with me, I was able to find out that even though she's on a fixed income and she does qualify for SNAP, unfortunately, as I mentioned before, because of the SNAP cuts, she had a reduced income of $23 a month for her SNAP benefits, which is honestly not something that anybody could survive off. $23 a month is less than maybe $1 a day to be able to buy groceries and basic things to eat. So this elderly lady, I logged into her SNAP case. I saw that all the information in her SNAP case was not correct, unfortunately. A lot of the seniors in our community are misinformed regarding the benefits that they're eligible for, and the requirements to said benefits. So this particular lady, I corrected all the information in her SNAP case. She was also having trouble with her Social Security benefits. She was receiving letters that she needed to recertify her Social Security benefits. And unfortunately, she did not have a working phone at the time. And these interviews for Social Security, they have to be done over the phone. If it's really needed, they do an in-person appointment, but to be able to do an in-person appointment, you will need a phone to be able to schedule that. So Help 365, we helped her get a government funded phone so she could be able to recertify for her Social Security benefits so they won't get cut off. Once we helped her with the Social Security recertification and the government phone, she did get a slight increase in her Social Security benefits. And we also helped her maintain her rent, since she was falling a bit behind as well. We helped her with our rental assistance. And it was just very disheartening to see this older lady who has done so much for our community struggling just to find a basic meal. We were able to increase her SNAP benefits from $23 to $281 a month. It's still not enough for her, but it's way more than the $23 she was receiving before. And at least it took a weight off her shoulders to know that she has a little bit of extra coming in every month, that she doesn't have to necessarily worry too much about her next meal. We also introduced her to our hygiene services. We have a program called Project Dignity. And this particular lady, she was having trouble with getting her laundry done. So we informed her about our services here with the laundry and the showers, and we made sure we help her get her laundry done on a weekly basis. So she's a little bit more cut now, more food in her stomach, and that's just honestly one of the reasons why I love what I do here, because it's stories like these that make you see how our community is struggling, and we're able to try to lift them up out of that food insecurity and that feeling of helplessness. And unfortunately, our seniors, they're one of our populations that they struggle a lot. And it's very good that I was, able to clear things up for her to make sure that she got the
Absolutely.
appropriate benefits.
No, thank you, Diana. That's absolutely, it was very impressive and very important. And I think it speaks to that conversation that we were having recently about the layering of services and how we can layer those services and make impact by bringing in resources, by helping them access every food program, in this case, a hygiene program, the government issued phone. All these things make a huge difference. And I think a lot of times, people are not aware that these are the sort of services that we can provide. For seniors that are eligible for SNAP, I'll just add that they're automatically able to enroll in our Nourish program, the Commodity Supplemental Food Program. That's a huge food package. You're allowed to access that once a month. It's 23 meals in addition to receiving SNAP. And of course, we will enroll you in our pantry too. So we can really make huge difference when we layer these services. And that's kind of one of the roles that Diana has in screening people and meeting them and understanding what their needs are, and then we can refer accordingly. Let's shift gears for a second, Diana, and talk about migrants. We have seen huge increases. Here's some data, and then maybe you can give us some examples and some stories. We've had a 78% increase in the number of new intakes. Household increase 78% compared to last July. And what we've seen is that of the 664 new individuals that came in the month of July through our Choice Pantry, just our Manhattan program now, just Manhattan, 54% of those people are migrants. So the migrant crisis is very real. It's something that many organizations who do this work are starting to see, especially if you have shelters or facilities near you. We happen to have 3 within walking proximity to the New York Common Pantry's location in Choice Pantry, Manhattan, 109th Street. And so we've seen big increases in the number of people coming, and their needs go quite deep. And of course, there are challenges in serving them. So with that, Diana, maybe you can talk a little bit about eligibility, and maybe tell us a story of an individual you've helped, but also some of the challenges and what we can and cannot do for migrants.
Yes, so a lot of the migrants that are coming to us, unfortunately, Homeland Security takes their identifying documents. So they're just here with the paperwork that immigration gives them. A lot of them also come with just the clothing on their back. They don't really have anything else to wear. And it's very disheartening, unfortunately. They come over here with the expectation that they qualify for our government programs. And again, this is where a lot of the misinformation is going around in our community. Or the migrants that are coming here, they don't qualify for our government programs. What we're doing to help the migrants coming in here, like my colleague Stephen said, we have 3 facilities that opens up near us, and we've been seeing a lot of migrants coming in. We have been working with this new wave of people coming in because a lot of them, they are in shelters that are what we call non-cook facilities, meaning they don't have a kitchen. They can't store water, milk, things like that because they don't have a refrigerator. A lot of these places also are having problems with the plumbing in the location. So what NYCP is doing, what we're doing is we tailored a specific package for them. We call it the non-cooking package. And it's just a way to give them sustainable things that they're able to take back with them, and it's able to last them until they come back and pick up their pantry packages again. We're also, like I said, since they're coming with the clothes on their bag, we're also giving them referrals to go to other places so they can acquire free clothing as well. And we're seeing an increase of migrants coming in to use our shower and laundry services also. One example is I was working with a migrant family. She crossed the border with her husband, but unfortunately they got separated there, and she has been in holding with immigration for, I believe I saw her last time maybe 2 weeks ago. So that would make it maybe about 15 to 30 days already that he's been in holding with them, and she has no form of communication with him. So what we're doing is we actually are working with an organization that provides free immigration help. And we referred her to that said organization to see if there's any way that she can get in contact with her husband, see if she can find anything out, because she is here with her 4 kids by herself. She did initially come with her husband, but unfortunately, he doesn't know where she is. She doesn't know where he is. And it's pretty sad to see. We're trying to see if there's any way we can assist with that. We are also working with different organizations that provide free English classes as well. We've been trying to help our migrant participants go into those locations, because a lot of them, they're on the fence. They've received a lot of discrimination and they're just very scared. So we try to build their confidence and let them know that we are here to help, and we are recommending you to places that would like to help also. Free immigration services, it's very, very needed among the population. Because like I said, a lot of them, they're misinformed. They come in here thinking one thing, and it's honestly not that. So we try to inform them the best that we can, give them referrals to places that can actually provide English services, immigration services, things that will benefit them in the long run.
Thank you. Diana, can you also talk a little bit about the formerly incarcerated? I know that oftentimes there are very few options housing-wise and resource-wise, obviously difficult for them to find employment. Can you talk about some of the services we provide for that population?
Yes, so New York Common Pantry, like I said, we see a whole variety of people from the community. One of the populations we see is in the formerly incarcerated. They come here looking for just basic documentation help. One of the things that we do in the Help 365 and Project Dignity offices, we help our participants acquire their birth certificate and also state ID and the city ID as well. So the formerly incarcerated that come to our location, this is their first stop in help, because they know that we're the ones that we could help them acquire these basic documentations. They're trying to get back on their feet. So we help them acquire that. We also help them with employment services. We do give employment referrals out. We have a specific program that we work with. It's called, if I am not mistaken, the HOPE program. And they work with formerly incarcerated participants of ours. We also have certain supportive housing options that we can help them apply for. It's difficult for them to get adjusted back into the community. So we try to make it as easy as we can for them by signing them up for pantry and just referring them to places that can help them get clothing for interviews. We help them also with specific job trainings as well. So let's say if they need classes for resume writing or things like that, we can refer them to organizations that help them with that also. That's part of our self-sufficiency goal that we try to instill in our participants.
Absolutely. I think self-sufficiency and stability are two really important words, and they sort of underline all of our programs, really trying to help folks do what they can so they don't have to come to emergency feeding organizations to get the bulk of their needs fulfilled. So a couple of questions have come in. Indeed, when we talk about food insecurity amongst the senior population, I believe that definition is 60 plus. That is the national eligibility age for our Nourish program, the CSFP program. So when we talk about 1 in 5 New York City seniors being considered food insecure, we're talking about 60 plus. Other question about the pre-pandemic versus now and the numbers and the statistics, what we're seeing. We in the year fiscal 19, we served around 6.2 million meals a year, which is a whopping number in and of itself. Because of the pandemic, the implications of the pandemic, inflation, SNAP cuts, migration issues, we've literally had a million meal a year increase for each of the last 4 years. We're now, as I mentioned earlier, almost 10.2 million meals. So that number continues to rise. This is very true for all of the major crises that we've seen, whether it was the economic crash or Sandy, previous round of SNAP cuts after stimulus funds went away, and the challenges, of course, with COVID, as I mentioned. So every time the numbers continue they don't go down to where they used to be. This one's a little bit different in the sense that it has stayed up significantly. And because inflation really has impacted, and now it's just one crisis after the next. So we often say that food insecurity is itself a crisis, but when you layer on all these other factors on top of the wage structure and these challenges and these crises that happen in the economy and public health crisis or natural occurring disasters, you really start to see the problems mount and food insecurity rise as well. Dana, you shared a lot of stories today, and I want to make sure that we don't run out of time because I do want to say a few words at the end. But is there any other story, and if the answer is no, fine, but anything that we missed that we didn't get to you wanted to share?
Well, we also have been seeing, I just wanted to let you know, we've been seeing a lot of single fathers come into our location as well, yes. Some migrants that come in, unfortunately, it's single fathers that come with their kids. Just last week, we accommodated a single father with his two daughters, one son. They're taking English classes. We help them get into one of our English classes. They're taking English classes during the week, and unfortunately, where the facility that they're in right now, they're having a plumbing issue. So unfortunately, they don't have running water at the moment. So we're accommodating them come into the building just so they can have a shower, just so they can feel, comfortable, clean. That's one of the things I forgot to mention, that we have been seeing a lot of single dads coming into our location also.
Right, and not necessarily something that we've seen in these numbers before, so definitely noteworthy. So just one other thing, a question was asked about what are the types of food that we give out in our pantry packages. So the answer to that are protein, grains, fresh fruit, fresh vegetables, and dairy. Just one of the other questions that we received. And we are indeed open 7 days a week. We have brown bag programs on the weekends. So for those people who need emergency food, we do have a Saturday pantry at brick and mortar locations. And of course, we do hot meals throughout the week. But 365 days a year, you can get food through our programs at the New York Common Pantry. Diana, I want to thank you for talking to us today, telling the stories, and just bringing faces and real life experience to a lot of the data and the things that we're seeing. So thank you so much.
No, thank you very much for having me. It's honestly my pleasure being here and sharing these stories. It's important for us to get this information out there so people could understand this is what we're here for. They should not be embarrassed. We're here to help. They could understand food insecurity. It's not just going to go away. It needs to be a group effort in order for us to be able, to
agreed. So thank you, and thank all your peers for all the great work you do.
Thank you.
We hope that this has given some perspective on hunger and food insecurity, the official poverty measure, income inadequacy, and how the New York Common Pantry helps individuals who come and present with some of the issues that we've been talking about. We do have the capacity to do even more. And I also want to give it mention to those folks participating today. If you have a topic you would like to hear us to cover, please send that to us, whether that be homelessness, whether that be diving deeper into the migrant crisis, whatever the issue may be. We'd love to cover some of those topics with you in our upcoming State of the Hunger webinar sessions. I want to mention that we're doing more, and we are undertaking a major initiative. We recently purchased and renovated a 23,000 square foot food storage and distribution hub. We call it the hub for short. We have 182 food sites that we are currently serving on a regular basis, in addition to the 100 one-offs or pop-ups that we served last fiscal year. We're looking to address food insecurity in every possible way in every community that needs it, communities that may not have the capacity. So this hub allows us to serve more sites, and the space enables us to serve almost double the amount of food, including refrigeration and more produce. So we'll be able to serve double the amount of families we're now serving at a lower cost per meal. We've already estimated that we're going to save about 20% on certain orders, whether that be examples of milk, shelf-stable milk are some examples, as well as oats, pasta. So we've seen some savings, and we know that will allow us to stretch our food dollars, serve more people, including the increased need. We are raising money for the facilities upgrades to increase the fleet, to serve those new sites, and to purchase even more food to hire the staff to distribute it. So please stay tuned for our major initiative, which will be announced in the coming months. If you're interested in getting involved, there are many ways that you can help. Please spread the word. Tell people about the issues of food insecurity, and mention how we assist those in the community, how we help those in the community in need. with many services that we provide, and we can also help individuals refer to community-based organizations in their community as well. So there's a big, strong suit of our Help 365 team. Please come to volunteer, organize a day of service, come see us in action. You can organize a group of friends or coworkers or volunteer yourself. We have groups from small to very large. With the new hub, the aforementioned hub, we have the ability to serve, to have about over 100 volunteers in a shift. So we can have takeover days with your firm, your businesses, your faith-based organization, etc. Consider making a donation. As mentioned, we purchased nearly last year, 55% of our food was purchased. Good news is that that number goes down as we rescue more food, but it's still a very expensive proposition. There is an enormous cost to doing business and providing the services that we provide, and we rely on the public for much of our resources and much of our fundraising. And of course, you can start a drive. We collect food and other goods which we utilize to make our pantry packages all year long. So we do have that on our website. You can access how to help, or if you want to go to community partners drop down on our website, you can see some of the ways that you can get involved if you can't make it here. So I want to thank you all. I think we're coming in right on time. Thank you for your time today. Again, reach out to us if you have any additional questions. We'll put up some contact information on the next slide. Please feel free to reach out to us. And again, feel free to suggest any topics that you'd like to see. Thank you. Have a great rest of the day and summer. Bye now.
Thank you all for joining so much. For any of you who sent questions that we were unable to get to, we'll be sure to email you back with the email that you used to register. And thank you so much again.